Wegovy HD is FDA approved at 7.2 milligrams, 3 times the usual 2.4 milligram dose. It produced more weight loss, but nowhere near 3 times more. In the main trial, the average advantage was only about 3 percentage points. The real clinical question is simple. Does that extra loss justify the higher rate of nausea, vomiting, and unusual skin pain? Wegovy contains semaglutide, which reduces hunger, strengthens fullness, and slows food leaving the stomach. A higher weekly dose keeps more medicine active in the body. That usually means stronger appetite control, but it also increases stomach and bowel side effects. The important point is that dose and benefit do not rise in a straight line. Tripling the dose does not triple appetite control or weight loss. Once the main effect is already strong, each additional increase usually produces a smaller gain, while side effects continue to accumulate. The 7.2 milligram dose does not change how treatment starts. Wegovy still begins at 0.25 milligrams weekly and increases step by step. Adults must first tolerate 2.4 milligrams for at least 4 weeks. Only then does the higher dose become an option. Standard Wegovy treats adult and adolescent obesity, reduces heart attack and stroke risk, and treats a fatty liver disease called MASH. Wegovy HD is different. The 7.2 milligram dose is approved for adult weight reduction, not as a replacement dose for every other Wegovy indication. The approved product is a separate 7.2 milligram single-dose pen. It does not mean using 3 2.4 milligram pens. That approach is unapproved, increases the chance of dosing mistakes, and is not the product the FDA evaluated. The Step Up trial explains why the new dose exists. It followed 1,407 adults with obesity for 72 weeks. Participants received 7.2 milligrams, 2.4 milligrams, or placebo, an inactive injection, along with diet and activity support. People with diabetes were excluded. Counting everyone assigned to a study group, the 7.2 milligram group lost 18.8% of starting weight. The 2.4 milligram group lost 15.5%, while placebo produced 3.9%. The higher dose added 3.3 percentage points beyond standard Wegovy. A second analysis estimated results among participants who followed treatment as planned. Average loss reached 20.7% on 7.2 milligrams and 17.5% on 2.4 milligrams. For someone starting at 250 pounds, that difference equals roughly 8 additional pounds. The strongest responders separated more clearly. About 1/3 of participants on 7.2 milligrams lost at least 25% of their starting weight. Only about 1/6 reached that mark on 2.4 milligrams. The higher dose roughly doubled the chance of reaching that very large loss category. Individual results vary. Some patients may see almost no difference after moving above 2.4 milligrams. Others may cross an important threshold for mobility, sleep apnea, joint pain, or surgery eligibility. The average result hides that wide range. Every group also received reduced calorie eating guidance and a goal of at least 150 minutes of weekly activity. The drug was tested with structured lifestyle support, not instead of it. Protein, hydration, movement, and consistent eating still matter at every dose. The extra weight loss came with more side effects. Nausea affected 39% on 7.2 milligrams, compared with 35% on 2.4 milligrams. Vomiting affected 22% versus 16%. Vomiting showed the clearest increase, rising 6 percentage points. Constipation changed very little, affecting 20% on 7.2 milligrams and 19% on 2.4 milligrams, so the higher dose did not worsen every symptom equally. The trade-off was specific: a modest increase in average weight loss with more nausea, vomiting, and skin symptoms. Timing matters. The extra weight loss builds over months, while nausea or vomiting can appear quickly after a dose increase. A patient may feel worse before seeing any added benefit. That is why the first several weeks after increasing the dose matter most. The most unusual new signal was dysesthesia, meaning abnormal skin sensations. People reported tenderness, burning, tingling, or pain from light touch without a visible rash. It affected 22% on Wegovy HD, compared with 6% on 2.4 milligrams. Many cases improved during treatment, while some persisted. New skin pain from clothing or light touch should not be ignored, especially when it begins soon after increasing the dose. Despite more symptoms, stopping rates remain similar. Across the higher dose trials, about 5% in each Wegovy group stopped because of side effects. Most participants stayed on treatment, but that does not mean the two doses felt the same. The standard semaglutide warnings still apply. Severe upper abdominal pain can signal pancreatitis. Right upper abdominal pain, fever, or yellow skin can point to gallbladder disease. These symptoms need prompt medical evaluation. Wegovy should not be used by anyone with a personal or family history of medullary thyroid cancer, a rare thyroid cancer. It also should not be used by anyone with multiple endocrine neoplasia type 2, an inherited tumor syndrome. These restrictions remain at 7.2 milligrams. The dose decision should start with 3 questions. Is 2.4 milligrams still controlling hunger? Has weight loss clearly stalled over several weeks? Would additional weight loss meaningfully improve a condition such as sleep apnea, joint pain, or fatty liver disease? A strong candidate has tolerated 2.4 milligrams, still has substantial weight-related risk, and continues to struggle with hunger or a true plateau. That person has a clear reason to consider 7.2 milligrams. The goal is not simply to chase the largest number on the pen. A poor candidate is already vomiting, barely drinking, forcing meals, or repeatedly using laxatives at 2.4 milligrams. Raising the dose in that situation usually creates more problems. Weakness, dizziness, and consistently poor protein intake are also signs to pause before increasing the dose. Check for overlapping medicines. Wegovy HD should not be combined with Ozempic or another semaglutide product. Combining it with another medicine that works like Wegovy adds side effects without proven benefit. People with type 2 diabetes need a separate discussion. In a diabetes trial, average weight loss reached 13.2% on 7.2 milligrams and 10.4% on 2.4 milligrams. A1C, the 3-month blood sugar average, fell by 1.7 and 1.6 points. The higher dose added more weight benefit than blood sugar benefit. Insulin and older insulin-releasing diabetes pills called sulfonylureas may need adjustment when Wegovy increases. Both can raise the risk of low blood sugar when appetite and food intake fall. Glucose monitoring becomes more important during and after a dose increase. Beyond diabetes-specific monitoring, the general dose review still applies. Before increasing, review several weeks of weight, waist size, hunger, meals, activity, hydration, bowel habits, and injection technique. One bad week is not a plateau. A consistent pattern gives a much better reason to change the dose. After increasing, watch the first month closely. Smaller meals and lower fat foods can reduce nausea. Fluids matter more when vomiting or diarrhea appears. Treat constipation early instead of waiting until abdominal discomfort becomes severe. Repeated vomiting, inability to keep fluids down, very little urination, severe abdominal pain, or new painful skin sensitivity require prompt review. These are not symptoms to push through just to stay on the higher dose. Wegovy HD offers more weight loss, but the gain is measured in percentage points, not multiples. Its value is greatest when 2.4 milligrams is tolerated but no longer enough. The best dose is the one that controls hunger, improves health, and remains sustainable. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.